What is antisocial personality disorder? What does it have to do with the Turkish Olympic shooter Yusuf Dikeç? Do you have this condition? Does someone around you struggle with this disorder? What is the treatment for antisocial personality disorder? Hi, my name is Dr. A and I'm a board-certified lifestyle psychiatrist. The internet has been ablaze with news of the Turkish shooter Yusuf Dikeç. He recently went viral on social media for his casual, laid-back attitude while shooting his way to a silver medal at the 2024 Olympics. Shooting in a t-shirt with one hand in his pocket, minimal shooting gear, and an impassive look, he has been described in many ways. While some liken him to a regular guy competing at the Olympics, some have likened him to a hitman, a psychopath, and an antisocial personality. This has been because of his calm, collected affect and lack of emotional expressiveness. Unfortunately, this does not fully describe psychopathy or antisocial personality disorder. Without the proper psychological evaluation, I would not label someone a psychopath or as having antisocial personality disorder. Being calm and laid back is not the same as having such a disorder. I disagree with using such descriptions for this calm and collected silver medalist. Now, psychopathy and antisocial personality disorder are related but distinct concepts. A psychopath is a person who exhibits personality traits and behaviors characterized by a lack of empathy, shallow emotions, egocentricity, deceitfulness, and a disregard for social norms and the rights of others. Antisocial personality disorder is a diagnosable mental health condition. It is characterized by a pervasive pattern of disregard for the rights of others, a lack of empathy, and frequent involvement in criminal behavior. Psychopathy is often seen as a more severe form of antisocial personality disorder. So while all psychopaths meet the criteria for antisocial personality disorder, not everyone with antisocial personality disorder is a psychopath. So what is a personality disorder? A personality disorder is a pattern of inner experience and behavior that deviates significantly from the expectations of the individual's culture. People with personality disorders have altered ways of perceiving and interpreting themselves, others, and events. They also have altered emotional responses, poor functioning, and impulse control. To be diagnosed with antisocial personality disorder, the individual must be at least 18 years old, and there is evidence of disregard for and violation of the rights of others occurring since the age of 15 years. So let's talk about 7 traits of someone with antisocial personality disorder. Number 1, unlawful behaviors and failure to conform to social norms. This can present as repeated acts that are grounds for arrest. Number 2, deceitfulness. This may include repeated lying, the use of aliases, or conning others for personal profit or pleasure. Number 3, impulsivity or failure to plan ahead. As a result, some people may struggle to maintain their relationships. Also, job losses are common as some may feel the job is beneath them or because of repeated absences or anger outbursts at work. Number 4, irritability and aggressiveness. This may manifest as repeated physical fights or assaults. As a result, problems can occur in their relationships at work or at school. Number 5, reckless disregard for the safety of self or others. They may also blame others for their problems and engage in risky sexual or violent behaviors. Number 6, consistent irresponsibility. This may be repeated failure to keep jobs or honor financial responsibilities. Those who are parents may subject their kids to neglect or abuse. Their irresponsibility can lead to money problems and debt. We'll discuss the cause and treatment of this disorder after number 7, which is lack of remorse. Such people may show indifference to hurting, mistreating, or stealing from others. In some cases, they may even rationalize such behaviors. Some may believe they are superior to others and show a lack of compassion. According to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, having 3 or more of the above 7 meets the criteria for antisocial personality disorder. Now let's talk about the cause and treatment. It is important to know that this condition cannot be diagnosed during the course of severe mental disorders like schizophrenia or bipolar disorder. The severity of the symptoms varies from person to person. It can be more severe in some than others. No one knows exactly what causes antisocial personality disorders. Studies show that the cause is likely multifactorial, meaning it is likely due to a combination of many factors like genetics, environment, and trauma. People with antisocial personality disorder can often seem to be normal and even charming. Because of this, they can sometimes fool even the most experienced clinicians. Their histories, however, reveal many areas of disordered life functioning: lying, truancy, running away from home, thefts, fights, drug use, and illegal activities are typical experiences in their childhoods. There is no specific treatment for antisocial personality disorders. Psychotherapy can be helpful. Medications are beneficial if the individual struggles with rage, anxiety, depression, or other mental conditions. The good thing is that this disorder tends to burn out over time. So as people get older, their bad behaviors tend to slow down. They stop offending people and going against societal norms as much. Antisocial personality disorder is just one of several personality disorders. Some other personality disorders include paranoid personality disorder, narcissistic personality disorder, avoidant personality disorder, and borderline personality disorder. To find out more about borderline personality disorder, check out this next video.